This edition of Let's Talk Public Health This Way covers the Welcome to the Futures exhibit at the Smithsonian Arts Industries Building in Washington, D.C. The Futures exhibition temporarily reopened this museum since it closed in 2004 to give visitors a glimpse into the possibilities of the future and to inspire them to build a world we all want to live in. What does this have to do with public health? While not specifically about public health, the exhibit featured many innovations that are designed to address public health issues. Each of the 4 halls in the museum had a theme, starting with Futures Past in the North Hall. This part of the exhibit displayed innovations from previous generations, like Alexander Graham Bell's experimental telephone. The West Hall featured innovations designed to make a healthier, happier world, from pods that allow human remains to be composted, to farming rovers that use AI to nurture crops with stunning precision, and bioreactors that capture carbon from the air and convert it for reuse. Environmental sustainability was front and center. The South Hall explored new ways to connect and collaborate, from community-based medical manufacturing labs to visual communication systems using pictographs and exosuits to support and improve mobility. Health equity was a key theme in this part of the exhibit. The East Hall dared visitors to imagine what the future landscape might look like, from climate-neutral floating cities to submarine civilian housing. Environmental sustainability was again a focus in this part of the exhibit. The exhibit had several engaging and interactive components, including full-size prototypes, digital kiosks, interactive sculptures, handwritten action cards, and in-person visitor surveys and interviews. So why talk public health this way? The 6 types of interactives invited visitors to share their thoughts about the future. And the museum shared that data with private research firms and think tanks. And this is what they found. Number 1, people respond better to inspiration than fear. Over 75% of people felt more hopeful after seeing the exhibit and felt inspired to act to shape the future they desired. Public health professionals and organizations need to balance the facts and projections related to major public health issues like climate change, which tend to be more doom and gloom, with messages of hope and inspiration. Number 2, people have more faith in technology than other people. The data showed that people are more likely to be optimistic about potential solutions to large-scale crises like climate change when those solutions rely on technology, personal action, or innovation, rather than those that rely on human cooperation and empathy. Number 3, people need to see to believe. Being able to see real-life tech solutions that are being developed by real people helped over 80% of visitors to be able to imagine a better possible world. Public health professionals and agencies are good at giving people the what and the why, but we need to also share the technological how. If we do that, we may be able to inspire individual level changes that complement those technological solutions. What could have been a run-of-the-mill survey was instead an immersive experience with full-scale prototypes and interactive activities that gathered over 1 million insights from 650,000 visitors. Thanks for tuning in.